Hi, my name is Geraldine. I'm currently a nursing 4 student.
Hi, my name is Genesis, and I'm also a Nursing 4 student.
Today we're going to give you a tour of the Nursing Arts Lab, commonly referred to the NAL. We're going to start with our practice room. So this is the practice room where you can typically practice with your other classmates. There's 6 low fidelity mannequins. Fidelity is meaning realism, and as you can see, the mannequin is not as realistic as the mannequins we're going to be showing you later in the video. You can practice skills such as physical assessment, vital sign, IV insertion, depending on the course you're in. As you can see in the example, she's doing a manual blood pressure, one of the vital signs, and that's not really easy to do. I remember being nervous when I started my first manual blood pressure. So you could schedule practice time when there's typically no class or lab.
Or anytime you feel like you need to brush up on your skills, you can just schedule an appointment, come in with a friend, or just by yourself, whatever you prefer.
Yes, typically in the NAL, this is just where we practice our skills or we have lab or simulation experiences. And you can expect to be in the NAL typically about 1 to 2 days a week, depending what course you're in.
So we're walking you into one of the patient rooms, and in these rooms, there's 4 mannequins, and this mannequin here is, as we talked about before, the low fidelity mannequins. As you can see with the setup, we can get to practice tracheostomy care, which you will be learning in the program, and other important skills such as vital signs, assessments, etc. And here we have the medium fidelity mannequin. So what sets this mannequin apart from the low fidelity is it has more realistic bowel, lung, and heart sounds, and it can even speak. And these sounds can be changed so that you can learn what's abnormal versus what's normal in a patient. So we also get to practice blood pressure and use other supplies around the mannequins as well. And in these rooms, you do get to practice your handoff reports, which is an important skill to start to practice for clinicals. And we can do physical assessments, vital signs, as I mentioned, and SBAR, which you will learn about as well. And overall, this mannequin can also provide you with a simulation experience as well.
Yes, definitely. This is great for visual kinesthetic learners like myself because you really see what you're learning in theory in the lectures come to life.
Exactly. And just having that hands-on practice helps build your confidence. So I love coming here. I come here all the time because it doesn't matter how many times you got a skills down, you just need to keep brushing it up because over time we forget. So it's always good to come back and practice old skills as well.
Yes, and speaking of confidence, this is a great place. This is a simulation lab where we have high fidelity mannequins, and you can see how realistic these mannequins are. Even their skin is very similar to human skin. They have lung sounds, heart sounds, bowel sounds similar to a real human. And this is another high fidelity mannequin that simulates a birthing experience with her cute baby there. And I'll bring you to this room. This is the control room where our professors are able to control the mannequin crying, talking, speaking. And this is where you can actually use the skills that you've learned and apply it, show off those skills basically. And yeah, that's basically it.
I remember being in my first simulation. It was super scary. I had to play the role as the nurse. And at the end, even though it was scary, I learned a lot. And it's just a learning experience. You don't have to be hard on yourself if you make mistakes. We're here to learn and just have fun.
Yeah, exactly. I always get nervous.
So I'm walking you now into the nursery, one of my personal favorite rooms. And in the nursery, we have low fidelity mannequins such as these, and high fidelity even. And these are super useful with just getting comfortable practicing on the pediatric and neonatal population. and just getting comfortable handling them, taking care of them, assessing them, all those things. So as you can see, the student here is just practicing on the baby.
All right, so we're going to take you to our classroom setting where they usually have low class,
Small group activities,
lectures,
lectures.
group activities. And this concludes our tour. Thank you so much for letting us share our experiences with you.
And for more information, go on Valencia College Nursing website. Thank you.
Thank you.